Apple Card is the perfect card for your holiday shopping. When you use Apple Card on your iPhone, you'll earn up to 3% daily cash back on every purchase, including products at Apple like a new iPhone 16 or Apple Watch Ultra. Apply now in the Wallet app on your iPhone. Subject to credit approval, Apple Card issued by Goldman Sachs Bank USA, Salt Lake City branch. Terms and more at applecard.com. Apple Card is the perfect card for your holiday shopping. When you use Apple Card on your iPhone, you'll earn up to 3% daily cash back on every purchase, including products at Apple like a new iPhone 16 or Apple Watch Ultra. Apply now in the Wallet app on your iPhone. Subject to credit approval, Apple Card issued by Goldman Sachs Bank USA, Salt Lake City branch. Terms and more at applecard.com. You're listening to Wellnow, Slate's podcast on health and wellness. I'm Maya Feller.
And I'm Kavita Patel. Today, we're diving into a topic that affects literally half the world's population, yet remains shrouded in mystery and misinformation.
It took me 6 years to fix my hormones after coming off of hormonal birth control.
From a very young age, we are not properly taught how to support our bodies with nutrition and stress management.
I feel like I've been fighting with my mind and my body. I've had really bad brain fog. I feel like I've been very anxious.
So by the time we reach maturity, our hormones are an absolute mess. And conventional medicine's remedy for that is synthetic birth control.
We're talking about women's hormonal health. And let me tell you, as someone who's spent a long time studying this, there's still so much we're learning every day. Our hormones influence everything from our mood and energy levels to our fertility and long-term health. Yet so many women feel completely in the dark about what's going on in their own bodies. Hormones play a crucial role in regulating various aspects of women's health, influencing everything from reproductive function to overall well-being. Estrogen, progesterone, and testosterone are the primary sex hormones in women, each serving essential functions throughout different life stages. Estrogen is responsible for the development of secondary sexual characteristics, which for girls include things like growing breasts and widening hips. It also regulates the menstrual cycle and contributes to bone health. Progesterone prepares the uterus for pregnancy and helps maintain it. And testosterone, though present in smaller amounts in women, contributes to libido, bone density, and muscle strength. Hormonal imbalances can lead to a range of health issues and symptoms. For instance, estrogen dominance can result in premenstrual syndrome, weight gain, breast health issues, and mood swings. Maya, have you had any experience with any of the above symptoms personally or professionally?
Yes, I can say that I've experienced them both personally and professionally. When it comes to PMS, 100%, that's something that I dealt with myself. The mood swings, for sure. Weight gain, definitely in pregnancy. Across the board, also, when it comes to my job, 100% people come in really talking about PMS, body composition shifts. There's a lot of discussion around breast health, whether or not it is dense breasts and not specifically breast cancer, but also that as well, and mood swings, Kavita. So yeah, that is completely right. I like to think of hormones like the body's chemical messengers because they affect everything from our mood and our energy levels to metabolism and reproductive health. And it's really fascinating how these tiny molecules can have such a profound impact on our overall well-being. I've seen patients coming in, as I said, with these issues ranging from irregular periods to challenges with fertility to unexplained weight gain or body composition shifts and chronic fatigue. What about you, Kavita?
Yeah, I think the reason I mentioned that I've been kind of obsessed and studying this for a long time is that I've told you about the kind of three main sex hormones, estrogen, progesterone, testosterone, and kind of what we know about them. But I feel like we still don't know so much. And sometimes I think as physicians or health professionals, we will dismiss things and say, could be hormonal, especially if it's someone, pick your time period. It could be someone going through puberty, could be someone going through, just their menstrual cycles, could be perimenopause, could be menopause. Everything can have kind of a hormonal underpinning to it. And so it becomes a really important driver of medical conditions, but at the same time, it becomes a little bit of this like default kitchen sink. I don't know the answer, so it's hormones. And then you don't know what to tell a woman. And because of what we have done from a very flawed study early in the 2000s called the Women's Health Initiative, where we told women not to take estrogen for fears of cancer, only to find out decades later that we were wrong and that study actually wasn't that great.
New information this morning on what has been a somewhat confusing topic, hormone replacement therapy for women going through menopause. It had been thought that HRT could increase the risk of breast cancer, among other things, but new data being released now shows that is not the case.
And now we're trying to figure out that balance, as we've talked about on this podcast, Maya, around menopause and the role of hormones. I think it's incredibly crucial that we talk about how hormones change throughout a woman's entire life cycle. From puberty to pregnancy, through perimenopause and menopause, our hormonal landscape is constantly evolving. And it's not just about the estrogen and progesterone and testosterone that I mentioned. It's the entire kind of endocrine system that includes thyroid hormones, that includes cortisol, insulin, and testosterone, which I think some people are surprised to talk about in women because they play a vital role in their health. So Maya, just to pick on this a little bit more, does testosterone ever come up in discussions with some of your patients who identify as female?
Oh, absolutely. It comes up for sure in relation to lean body mass, specifically around the menopausal transition. So when we start to see an increase in the free fat mass and then a decrease in that lean body mass, it's a conversation that we have often in session. And it's interesting because a lot of patients, my women patients, they really don't realize that they produce testosterone, and they don't realize that as they age, even though it's small, testosterone production, that it decreases. And it's so funny, Kavita. I remember when I was teaching at NYU, there was this section where I would say like, oh yeah, if you don't move it, you're going to lose it, talking about lean body mass and people moving through the life cycle. And I think probably now as a dietitian in my own age and stage, I'm like, oh, it really is true. If I don't move it, I'm going to lose it. And it's funny because when I think about my patients and I think about those times when I was teaching, they don't realize that the testosterone is important for things like muscle strength, bone density, and even like their libido. So a lot is lost in that, I'd say, probably societal conversation that sometimes I try to bring into the session. And then for sure, there's always this discussion around the role of dietary patterns and the endocrine system. And this is something that all dietitians have been talking about forever. We've been talking about insulin resistance. We've been talking about pre-diabetes, diabetes. We've been talking about pre-hypertension, hypertension. And it's like, these are not sexy conversations. So people are kind of like, well, does it really matter? And we're like, it absolutely does matter. And I can't say it enough. I really talk about the importance of what does your pattern of eating look like, right? What are the high quality proteins that are showing up on your plate? Are they coming from animals? Are they coming from plant sources? What about the fiber, the beans, the nuts, the seeds, the ancient grains? And then I talk about the importance of pairing those things together, but then also the phytonutrients, because that's what helps to tamp down the body's imbalance. And when we're talking about the endocrine system from a nutrition perspective, those are the avenues that I encourage people to really dig deep and dive into. I also have to say that nutrition, it doesn't exist in a silo. Exercise, navigating stress, sleep quality, it's all crucial in terms of maintaining the body's hormonal balance.
Exactly, Maya. And there's so much more that we need to discuss. So after the break, let's bring in another voice to help us dive deeper into caring for our hormonal health. Stay tuned.
Hey, Wellnow listeners, if you're enjoying the show and want to hear more, subscribe to our feed. New episodes come out every Wednesday morning. While you're there, check out our other episodes too, like last week's about the rise in alarming side effects connected to frequent marijuana use. Check it out. Apple Card is the perfect card for your holiday shopping. When you use Apple Card on your iPhone, you'll earn up to 3% daily cash back on every purchase, including products at Apple like a new iPhone 16 or Apple Watch Ultra. Apply now in the Wallet app on your iPhone. Subject to credit approval, Apple Card issued by Goldman Sachs Bank USA, Salt Lake City branch. Terms and more at applecard.com. This episode is brought to you by Lumen. Your metabolism is your body's engine, so optimizing your metabolic health translates to easier weight management, improved energy levels, better fitness results, and better sleep. Introducing Lumen, the world's first handheld metabolic coach. To use Lumen, all you have to do is breathe into your Lumen device first thing in the morning, and then the app lets you know if you're burning fat or carbs. Then Lumen gives you a personalized nutrition plan for that day based on your measurements. When I used my Lumen, I breathed into it before my workout and also after my workout. And it was really interesting because I saw whether or not I was burning carbohydrates or fats, and then I modified my nutrition accordingly. Take the next step in improving your health. Go to lumen.me/wellnow to get 15% off your Lumen. That is lumen.me/wellnow for 15% off your purchase.
Welcome back. You're listening to Well Now. I'm Kavita Patel.
And I'm Maya Feller. We're getting to the heart of women's hormonal health with Alisa Vitti. She's a renowned women's hormone and functional nutrition expert, best-selling author, and pioneer in female biohacking. As the founder of FLO Living and creator of the cycle syncing method, she has revolutionized how women approach their hormonal health, empowering them to leverage their natural cycles for optimal well-being, productivity, and vitality. Alisa, thank you for joining us.
I'm so thrilled to be here. Thanks for having me.
So we like to start out every episode with a question, and we always say it's not a trick question. Are you ready?
I guess so.
Okay. How do you define wellness?
I think I define wellness as the sort of relationship I have with my lifestyle, with my body, the time that I'm spending during the day, and is it bringing me vitality and joy and stimulation, versus am I feeling dragged down by what is taking place during my life? So wellness is definitely, for me, much broader than just a set of health practices. It's really the net outcome of all the inputs. And is that getting me that feeling that I want to have of feeling good in my body and in my life?
That's a great answer. And like we said, we're not trying to pin you down on any one thing, but that I think is it's a nice way to think about just hormonal health in general. But Alisa, we have to start also with your personal journey with PCOS, polycystic ovarian syndrome. Tell us about this experience and how it brought you here, how it got you interested in the topic of women's hormonal health as a whole.
Really it starts back at age 12 when I should have gotten my first period and I did not. And then that kept happening year after year. I was almost 16 when I had my first bleed, and I was really curious and concerned and frustrated as to why it was so delayed, despite asking, physicians about why it was delayed. It was just sort of continuously told, oh, it's normal, it's normal. And then the symptoms just kept progressively getting worse throughout the latter teen years. From the age of, let's say, 16 to 22, I only menstruated 4 or 5 times, 2 of which were chemically induced with synthetic progesterone, and still without a diagnosis. I'm 5'6". At my heaviest, I was tipping the scales at 210 pounds. I was menstruating almost not at all. I was covered face, chest, and back in painful cystic acne. And then I had a lot of mental health issues, anxiety, depression, insomnia, which, compounded the anxiety and the depression. It was extremely disruptive to my everyday existence. And if I didn't know before that hormones were really dictated the quality of your day-to-day experience, I knew it then. And of course, what does an insomniacal, girl do on a Saturday night? Well, she's in the library researching, in obstetrics journals and other medical journals, what could possibly be wrong with her, because I had been going to the gynecologist as soon as I was able to, which at that time was 16, asking what's wrong, and just, unfortunately being told nothing was wrong and it was probably just normal, which was, it's really shocking to think about that, right? And so I was reading an obstetrics journal and I found a little bit of an article about Stein-Leventhal disease, which sort of delineated the symptom set that I fit to a T, check, check, check. And it was a wonderful moment because it was so validating to know that there was something concrete that was going on, as opposed to this vague, we don't know what's wrong with you. And knowing that something was wrong, really knowing in my gut and in my bones that something was off with my hormones, but being told repeatedly that that couldn't be the case. So I brought that article to my gynecologist the next day, and she was so kind. I sort of scared her in the parking lot because I didn't have an appointment. I was very eager. After 7-8 years of not being diagnosed, I was like, I'm not waiting another minute. And she was very kind. We did the testing that I had asked for. And when she called me back in a couple of days later to review the results, she's like, you're right. You do have this disorder. This is what you have. And I said, fantastic. As a New Englander in me, I was like, great. Now what do we do? And she said, well, and this was really the inflection point of my personal journey and professional journey. She said, we don't really know what causes this, and we certainly don't have a cure. We don't even have adequate treatments. And what will happen, your prognosis is not great. You will develop potentially these diseases of inflammation due to the metabolic problems that you're having. This obesity could turn into diabetes, could definitely impair your ability to have children, could put you on a greater risk path for heart disease and cancer. And, I'm a young woman, and this moment was very interesting. I remember it vividly. I was in her office, sitting in the chair. She was talking, and all of a sudden I heard my body say very loudly, crystal clear, and I've written about this in my book, quote, "That's not your future." Really specific, it wasn't like I was thinking that, just that's what I heard. And so she said, what I can do is I can write you a prescription for birth control. And then as your symptoms get progressively worse, we can add medications that aren't necessarily designed for PCOS, but that we can use to maybe help with some of the symptom management.
That was definitely not what you wanted to hear, I can imagine.
Well, it just didn't seem good enough, Maya.
Yeah.
Right? It just was, I was like, well, why? And I asked her, I said, why would I take medication that isn't going to cure these issues that come with their own set of side effects and that do not prevent further medication down the road? She's like, yeah, that's all reasonable for you to think. And I said, so I'm going to go try to figure this out. And I don't want to go down this pharmaceutical path at this time, recognizing that you can always come back to pharmaceuticals should you want, but it's like cooking. Once you put the salt in, it's harder to take it out of the soup, right? So I thought, let me see what I can do on my own. And, was really inspired by what was coming out of the Human Genome Project at the time at Hopkins. They were looking at sets of identical twins and really narrowing it down that really what was moving the lever for each twin to either develop diseases or not were dietary and lifestyle interventions. And so I took my inspiration from that. And again, this is almost 30 years ago, where there was no functional medicine out in the world. And so I said, well, how can I use dietary and lifestyle levers to manipulate my endocrine function? And that was sort of how I got started. But the thing that it was twofold. It was sort of, I wanted to address this issue for myself and get resolution for my own self and put on my air mask first, or whatever, the oxygen mask first. But I also, in that moment in her office, recognized very profoundly how I was one of millions of other women who had not just PCOS, but other, as I've referred to them, hormonal castaway conditions like fibroids and endometriosis and ovarian cysts, and things that conventional gynecology just doesn't have a lot of support for. And I thought, if I can figure this out, I'd really love to make sure that other women don't feel the way that I'm feeling right now, which is overwhelmed, pretty freaked out about my prognosis, and without any support. So it was sort of this little big promise I made, which was, let me get well, and then let me help everybody else. And that's what I've been up to ever since.
And that's incredible because that was 25 years ago. And it's like, when I think about that, it was a very different landscape.
Yes.
And, so I almost want to like say, okay, let's fast forward. And that story for sure, in my mind, listening, right, informs your creation of FLO Living. And then also the development of what you call the cycle syncing method. So would you say that that is true?
Yeah, I mean, I'm interested in, having women feel like they have more agency between GYN visits, right?
Mm-hmm.
We've been fed a narrative for a long time. I mean, as long as biblical times, really, that your cycle is a curse, that you are destined for problems, and that you are a victim to those problems, and that you have no agency over them. And what I have found is that's wholly scientifically inaccurate, and that you do have a lot of ability to interact and improve the function of your hormones, but you have to understand how to do it.
Can you actually walk us through the basics of cycle syncing?
Yeah.
And then also talk about some of the evidence and the science around the method?
Sure. So I was looking at why it was that so many more women were suffering from hormonal issues compared to men. It's 80% of women have PMS. 80% of women will suffer from a hormonal problem at some point in her life. 50% of women struggle with thyroid issues. 1 in 8 women with PCOS, 1 in 10 couples with infertility issues. But when we look at men are not dealing with hormone problems at the same rate, right? And so I said, what are we missing? This is when I stumbled upon the infradian rhythm, right? Which is the rhythm that describes the menstrual cycle, but more than just when we're menstruating, it governs many systems of the body, right? It affects our metabolic rate at different times of the month. It affects our immune response at different times of the month, and our cognitive performance. I mean, it's just really interesting. And so fundamentally, I looked at this and said, okay, well, men operate hormonally on a 24-hour clock, but women really operate on this 28-day system. If we only take care of ourselves and think about our self-care in that circadian only way, no wonder we're ending up unintentionally disrupting this infradian rhythm. And so that's when I developed the method, right? We needed a way to biohack this rhythm. And that's how cycle syncing was born. So cycle syncing has 3 pillars. It has a food pillar, a fitness pillar, and a lifestyle, productivity kind of pillar. In the food pillar, we look at caloric management strategically across the cycle, because studies show that, for example, in the luteal phase, after you ovulate, you need 279 more calories per day. Why? Because you're 3D printing an organ every month called the endometrium, and you need extra calories to do that. But then in addition, because we're also looking at these estrogen surges, for example, during ovulation, we have our peak estrogen surge, but also during the luteal phase, we have a nice rise in estrogen, which for so many women, especially those who have PMS, is often unopposed by enough estrogen to prevent PMS. We want to use food strategically to help the body metabolize estrogen efficiently in the liver, but also to get it out of the body through the bowel, and even just breaking down the narrative that says you have to strive to eat the same every day, the same calories every day is the ideal standard. Well, that's true if you have male hormones, but it's not good if you have a cyclical hormonal pattern. And then the fitness piece as well, modulating what type of activity, what intensity of activity you're doing. Strength training and walking is great every day of the month, but you get huge strength gains in the first half of the cycle. And at the same time, you're the most able to tolerate intense cardio and HIIT workouts. Once you're cross ovulation, you cross over to the luteal phase, then you can still do all the strength training you want, but you want to kind of keep it focused on that lower zone cardio, not doing so much HIIT, but doing plenty of walking, whatever else that you want to do. And this coupled with what's happening with your increased metabolic rate really helps you use fat as fuel efficiently versus what we've been taught again, which is go hard every day, eat the same calories every day, do the same boot camp class every day. Women in the luteal phase, when you do that and you don't, sync your cyclical self-care, you actually can turn on muscle wasting and turn on fat storage, which is why so many women struggle to actually lose weight efficiently across the month. They might lose it in the first half, and then the second half, they feel like they're gaining weight and undoing what progress they've made. And then the third piece, which is the productivity piece, really leans into what's happening with the hormonal impact on your brain chemistry, right? My favorite example is just the ovulatory phase. With that super surge of estrogen, you are getting a beautiful charge of energy into the verbal and social centers of your brain. So it's only logical, right? The form of your lifestyle should follow the function of your biology in that moment. Organize things that leverage verbalizing and socializing, like plan an event, go give a presentation, do something that's going to take advantage of that superpower that particular hormonal ratio from that phase is giving you. Same can be said of the luteal phase. When you have this, if you're healthy and you're not dealing with PMS, you're going to have an abundance of progesterone for, this phase. And that has a calming and focusing effect on your brain chemistry. So do your deep work, schedule those types of things, and don't go out as often because it's going to drain you more in terms of your productivity. So really thinking about how do we strategically lean into what's happening and take full advantage of it while taking full proper care of it. And that's really the whole process behind it.
Alisa, your work challenges so many of these, kind of, as you mentioned, these conventional thoughts to just women's health, specifically women's hormonal health. For example, you don't advise people to use hormonal birth control to address these imbalances. What do you say to skeptics who want to, kind of push, I would say, more of, call it the more traditional thinking, even going back to kind of your personal experience of, oh, this is normal that you didn't have a period, and how they talk about hormonal health. What do you say to those skeptics?
I think skeptics and skepticism is healthy. It's part of the scientific process. I have no problem with it whatsoever. What I would say is, let's look at some of the information that we have available to us, which is, let's start at the very top. When it comes to birth control, using it to treat these specific types of conditions like PCOS and endometriosis and fibroids, this is not what that medication was designed to do initially, right? Secondarily, we now use this one medication for every woman's issue. In no other place in modern medicine do we have a single drug that treats all problems. It just doesn't sit right with me. And it's not nuanced enough. I would be much happier saying, okay, great. There's a special medication for endometriosis. Excellent. There's a special one for PCOS. Wonderful. Because that would mean that there was research and funding and studies being done for those conditions to develop those drugs, when we know, in fact, that there is none of that taking place, right? There's a huge gender bias in healthcare, in drug development, and it, of course, negatively impacts women. And then when we look at the side effects of the medication for women with these issues, we know that it depletes micronutrients like B vitamins and vitamin D3, the very micronutrients that the endocrine system needs to do its job of making hormones properly. And it disrupts the gut microbiome at the same level as taking an antibiotic. And you would know not to take an antibiotic for every day of your life without consequences. But we do that with this medication without telling women, okay, hey, you've got to onboard something to support your gut. And then there's a lot of research around the effects of that gut serotonin conversation, the disruption between the gut and serotonin production in terms of an increased risk for depression in women who use this medication. So not only does it not cure any of these conditions, or even necessarily improve quality of life for women with these conditions, but then they're having other health consequences that they're not made aware of in advance, and that can have lasting, effects that they have to deal with on their own somehow. So that's the other thing that I would just say, yes, let's be skeptical in general of something like this that's not good enough.
Right.
It's not good enough of a treatment. I think it's what we have. It's the best that we have. But I would like to see women have better.
Right. It doesn't seem like too much to ask for better or just good enough.
No, we're only more than half of the population. We deserve a little special care.
We're going to take a break here. When we come back, we'll hear more from Alisa Vitti on hormonal health and ways to take care of it. Stay tuned. This show is sponsored by BetterHelp. This month is all about gratitude, but there's one person we don't thank enough: ourselves. It's sometimes hard to remind ourselves that we're trying our best to make sense of everything, and in this world, that is not easy. Practicing gratitude can improve your personal well-being, and you might find it beneficial to learn gratitude-building techniques from a therapist. If you're thinking of starting therapy, give BetterHelp a try. BetterHelp can help you tackle life's challenges by providing accessible and affordable care. It's entirely online, and it's designed to be convenient, flexible, and suited to your schedule. With BetterHelp, you can message a professional therapist anytime, anywhere. Just fill out a brief questionnaire to get matched with a licensed therapist and switch therapists anytime for no additional charge. Let the gratitude flow with BetterHelp. Visit betterhelp.com/wellnow today to get 10% off your first month. That's BetterHelp, HELP.com/wellnow.
Apple Card is the perfect card for your holiday shopping. When you use Apple Card on your iPhone, you'll earn up to 3% daily cash back on every purchase, including products at Apple like a new iPhone 16 or Apple Watch Ultra. Apply now in the Wallet app on your iPhone. Subject to credit approval, Apple Card issued by Goldman Sachs Bank USA, Salt Lake City branch. Terms and more at applecard.com.
Fever, cough, congestion. When the symptoms keep coming, but you've got to keep going, you can rely on Mucinex Fast Max All-in-One. Just one dose of Mucinex Fast Max All-in-One relieves up to 9 cold and flu symptoms, helping you get on with your day. Need cold and flu relief? Get Mucinex Fast Max All-in-One and Done Relief. It's comeback season. Use as directed.
You're listening to Well Now from Slate. I'm Kavita Patel.
And I'm Maya Feller. And we're continuing our conversation with hormone health expert Alisa Vitti. So you mentioned that hormonal birth control can mask underlying conditions. Tell us about how you came to learn this.
It really just through working with women over the first decade of my practice in New York, just really seeing how over and over again women were coming with all of these issues. And then, they were on birth control, not happy with it, and wanting to work toward a way off of it. And really partnering with their physicians to transition them off safely. Taking synthetic hormones is serious business. I don't recommend anybody just go off of them cold turkey. I think it affects absolutely every part of your body. So you want to make sure that you do that under medical supervision. But before you do it, you want to make sure that you're prepping your body, so really taking the correct micronutrients. But it came from seeing it firsthand. And then, of course, there's now plenty of research that talks about this is not a cure-all. This is just a Band-Aid. And I think we all can appreciate that that's the situation.
100%. 100%. Like, that stands out.
And again, let me just make sure that I'm clear. If you want to use it for its intended purposes of prevention of pregnancy, have at it.
Right.
Take some probiotics and some other supplements with it. But that's what it is designed to do. It's designed to shut off your ovulation, to shut off actually all endogenous, internally produced hormones, right? And then you're taking them exogenously through this medication or the device, if it's an IUD or whatever it is. But just be fully aware of all of the implications and take care of yourself properly. But if you're using it to deal with a diagnosed condition, I would say after now helping women for 25 years, there is a different path available to you that has you first leveraging dietary and lifestyle changes, using food and supplements to help you improve your endocrine function so that it can do its job of improving hormonal balance overall. We can't whack-a-mole improve hormonal balance, right? It's very frustrating to try to do that. But if you strengthen the functioning of the endocrine system, that's when you can get the results. And that's what I experienced firsthand. It was pretty remarkable to go from all of my symptoms to losing 60 pounds without crash dieting or extreme dieting, to having my skin clear up and stay clear all these years, to getting my cycle back monthly. Somebody asked me, what do I do on the first day of my period? I'm like, oh, it's like the Queen's visit, I put on a nice outfit. I have my fancy teapot and teacup. I make my period tea and I have a nice day because I appreciate the visit. You see what I mean? I did not have my period from 12 to 22. So I appreciate every visit. I celebrate it. But anyway, that's a personal story.
I love that so much.
I'm probably the person who loves your period and everyone's period more than anyone on this planet. But we need that.
The Queen's visit.
The Queen's visit.
So this actually gets into something that I think listeners will be interested in because your MyFLO app has been very popular. How can one use it? How does it differ from other period tracking apps? And what benefits does it offer?
The MyFLO app I built so that it could be a period management and improvement tool, right? Because the idea is that back in, was it 2015 or 2016, the American College of Obstetrics and Gynecologists decreed that your cycle should now be considered a fifth vital sign, along with the 4 other ones that they take in the emergency room, right? So that means, we know what that means from, let's say, if you have a fever, you get all over that, right? You stay home, you take certain things, you do your ritual to help yourself with the fever, right? If you have PMS, however, because not everybody appreciates this historic decree, you ignore it still based on that old cultural mythology narrative that we have about it's a curse, you're destined to suffer, right? If you have heavy bleeding 1 month, you ignore it. You say, I don't know why that's happening, right? If you have massive cramps, you're like, oh yeah, I'm a woman. It's supposed to be painful. All of which are the incorrect response to those types of biofeedback. If you have PMS, it means that you have an imbalanced ratio of estrogen and progesterone in the luteal phase. Full stop. It doesn't mean that you're supposed to have those symptoms. It means you've got to get into action around fixing that ratio. And so the MyFLO app helps guide you on what to do with the dietary and lifestyle levers to help your body have a better period cycle after cycle. Because I'm not interested in you simply tracking. I'm interested in you biohacking your cycle so that you can have optimal health. And why? We know from the biocycle study that the NIH published now, 10, 12 years ago, that just having untreated PMS in your 20s, 30s, and 40s can increase by 2 times the rate at which you will develop the big 4 diseases of inflammation postmenopausally. So we're talking about increased risk for diabetes, heart disease, cancer, and dementia from this thing that we have a cultural joke about, like, oh yeah, I'm PMSing, ha ha ha, can't do anything about that. That's like having a fever. That's like having 140, blood pressure. You want to be real concerned and get into action. And that's what the MyFLO app helps you to do. It helps you to track this biofeedback through symptom evaluation. And then it gives you the guidance in real time of what to do with your diet and lifestyle that is very accessible to everybody.
Yeah. And Alisa, to your point, we have gotten to I'd say, stage in society where we normalize dysfunction. Can you share some of your key nutrition principles that actually support hormonal health and the research, the work that you've done with people? Because a lot of your work really talks about this connection between diet and lifestyle and then hormonal health. But yeah, share some of your key nutrition principles with us.
So, beyond cycle syncing, which is really, really applicable to every woman, unless she has PCOS or is on the pill or has some sort of amenorrhea, dysmenorrhea that hasn't been addressed, really making sure that you're focusing on supporting that endocrine hierarchy, right? So we want to first and foremost keep blood sugar stable. Without your blood sugar stability, your endocrine system doesn't have a fighting chance of helping you, make adequate levels of hormones, specifically progesterone, especially progesterone, because when blood sugar gets disrupted on a chronic basis, then we have cortisol that's recruited to help release stored fat as fuel, because the brain, the heart, and the muscle tissue are greedy. They need glucose. If you're not eating at the right cadence, if you're not eating the right amount of carbohydrates, fats, and proteins, and you're just skipping meals or doing what you think is trendy based on the latest wellness dialogue about intermittent fasting, or I don't know, maple syrup fasting, or there's a lot of stuff. It's confusing. But if we stick to what the body needs, right? The body needs stable glucose supply throughout the day. And then it needs for you to be managing your cortisol pattern. If you can get these two master regulating hormones supported with diet and lifestyle, then you have a really nice chance of having great progesterone outcomes every month, of slowing down the rate of ovarian aging and having a nice, easy perimenopause journey, right? For example, I am 47 and a half. I still have a regular cycle. I have no symptoms of perimenopause, right? And a lot of women write into our center at, 42, and they're struggling to get through the month. And that's because when we don't really support our body properly, these master regulating hormones, and then our gut health, we really have a difficult time with having a healthy, easy cycle the way it's supposed to. I think we need to really understand that it is our responsibility to protect our ovarian function through really engaging these master regulating hormones through diet and lifestyle. And that's sort of the, what I wrote about in my first book. And then cycle syncing is really the maintenance, how we bring it all together. That's the other thing that the app can help you with, is cycle syncing, right? And so, if you're feeling a little overwhelmed about how to get started with that and thinking, well, how am I going to remember what calories to eat and when should I eat certain foods? The app actually tailors a program based on your cycle phases and your symptoms. And so you can, just download the app. The app is free. And then for listeners, I'm happy to give you all a free month of the cycle syncing feature inside the app. If you put the code in wellnow, you're welcome to give that a try and just see what can happen with your period in a month. Be a researcher, be a citizen scientist of your cycle. What happens if you start to change dietary and lifestyle inputs as the app will be suggesting to you? How much better can you feel? How much less overall symptom burden and symptom severity can you have in a 30-day period? You would be amazed.
I think that it's an incredible field that you're just shining a lot of light on. I don't know, I would just say, like, so many people struggling and not knowing how to balance conditions, not even with diagnoses or kind of possible diagnoses like endometriosis or fibroids, but let's actually click down on people who have been dismissed or misunderstood, such as you were, by kind of conventional medicine. I keep returning back to this theme. What advice do you have for people who are listening and might be concerned just because they know their bodies better than anybody, and they feel like, whether it's through their physicians or any other health practitioner, they've just been dismissed? What can they do?
I mean, first and foremost, let's be really supportive of our physician community, especially those who are trying to take care of women. It's a difficult situation for everyone. And, what I hear from my physician colleagues is that they wish they were given more specific guidance and training on menopause, on dietary intervention. I mean, there's just, we have to recognize that everybody wants to be doing their best to take care of everybody. And so I'm always here to remind people that you're working with someone who's trying to care for you in the best way possible. If you guys are at an impasse, you're like, listen, I really don't want to do pharma, and this person is like, that's the only way forward, then maybe you find somebody else to work with. But that would be unusual, I think, in today's environment. As for the patient perspective, if you have a feeling about yourself, and I mean, everyone is living inside of their skin, and if you feel that something is off and you're not getting a diagnosis, keep pushing until you do. And what's different about today than 25 years ago is just the access to information that we have. You don't have to go hole up in a library and read some, random medical journals. You can really start to figure out pretty quickly what you might have from a, let's say, GYN perspective, and start to advocate for yourself. And it's important to learn how, especially if you're going to be someone who wants to be practicing self-care around your hormones, you have to learn to take up space and to take the leadership role. So when you take the leadership role, it might mean, that you recognize the role that you have to play in your care team, which is you're sitting in the driver's seat at all times. And anyone that you bring on your team, your physician, the MyFLO app, whatever else you're doing, they're a part of your team. And we all want to be aligned around your vision for what you want for your health, but you have to decide what that is. And owning that and being really self-accountable is the biggest leap forward, I think that we all have to make as individuals, because we're not given that training. We're given the opposite training to be sort of passive and feel like a victim. So that's the first mental leap to make. And then, of course, just keep pushing until you get the diagnosis and the care team that you are happy with around you.
Alisa Vitti is a women's hormone expert and founder of FLO Living. Thank you for joining us.
My pleasure. Thanks for a great chat.
That's our show this week. Wellnow is produced and edited by Vic Whitley-Berry. Ben Richmond is Slate's Senior Director of Podcast Operations, and Alicia Montgomery is Vice President of Audio. We'd love to hear from you. If you have thoughts on this episode, email us at wellnow@slate.com.
We'd also love it if you supported our show by becoming a Slate Plus member. Your monthly contribution is crucial to making this show possible. But don't worry, there's something in it for you too. You'll get perks like ad-free versions of this show and all of Slate's podcasts. You'll also get bonus episodes automatically in your feed. Like this week, where we talk with Alisa Vitti about her vision for the future of hormonal healthcare.
I think that gynecological care is ripe for disruption as soon as possible.
So if you aren't a member yet, be sure to subscribe to Slate Plus on Apple Podcasts or Spotify. To find out more, go to slate.com/wellnowplus and tune in next Wednesday as we tackle another part of the wellness industry. I'm Maya Feller.
And I'm Kavita Patel. Thanks for listening.